So there's a variety of skin conditions that can present on the feet, and I'm going to take each one in turn and tell you a little bit about each one. One of the most common skin conditions, non-infectious, would be hard skin, calluses. These can build up generally as a result of pressure on an area, for instance, on the top or end of a toe, or on the ball of the foot or the heel. And it's a reaction of the body to that increasing pressure to try and protect the underlying tissue. And the skin thickens up, becomes hardened, and unfortunately that can then add to the problem because it can actually put more pressure on the tissue. So it can become painful or even start to break down and ulcerate. Callus is fairly easily removed with a foot file, or a professional can use a scalpel, a sterile scalpel on it to gently remove the hard skin, or with a drill. There are some conditions whereby you genetically produce excessive hard skin, although these tend to be rarer conditions. If there's calluses on a high pressure area, particularly high pressure area, it can then develop into a cone-shaped bit of hard skin, which actually pushes directly into the tissues, and that would present as a corn then. So, for instance, a corn on the top of a hammered toe, a toe deformity, or on the ball of the foot on a particular pressure area. But there are different types of corns. There's the hard corn, Haloma durum. There's the soft corn, Haloma mullei, which is a corn between the toes where it has more moisture, so it's more macerated, and therefore it's known as a soft corn. Seed corns are tiny corns associated mainly with dryness of the skin. And then you've got corns that can cause a lot of trouble. Neurovascular corns, or smokers' corns, are very commonly seen in patients who smoke. And these corns can be quite troublesome for patients to walk on. And it's really important that they get the appropriate care in order that they can have more comfort in their lives. Corns can be really quite distressing for patients. Home treatments of corns can even cause more problems. So medicated corn plasters that are designed to burn away the hard skin can also burn away healthy skin. You can end up with a nasty ulcer or infection as a result of using such treatments. The good news is virtually all corns are curable. With the right treatment plan, you can get corns completely resolved. It's just about a matter of finding the right treatment plan for your particular corn, and there's lots of treatment options available to help you to get rid of your corns permanently, so they don't have to trouble you. Along with calluses and corns, you can also get dryness of the skin, and that can be anhydrosis, it would be the term for that, and that's will lead to more formation of things like seed corns, but it can also lead to flaking of the skin, cracking of the skin, fissures, particularly around the heels. And these issues can become quite sore for patients, particularly if those cracks go deep and they become what we call dermal fissures, and they're portal of entries for infection. And I've seen patients who've developed leg infections, so known as cellulitis, as a result of a crack from either the heel or a little split between the toes. The other thing that can happen very commonly between the toes is hyperhidrosis, which is excessive moisture. And that can occur particularly between the toes because the moisture can't evaporate, the perspiration can't evaporate very easily, but it can appear all over the foot and lead to secondary bacterial infection, conditions like Calluses, where you get little holes in the calluses on your feet as a result of excessive moisture. All of these things can be resolved with the right treatment plan, the right care. It's just a matter of identifying what's the best for the patient. Then we get the systemic skin conditions that can manifest in the feet. So the eczemas and the psoriasis type conditions, and these can really be quite debilitating on the foot because the foot's trapped inside the warm, moist environment of the shoe. So it can lead to itching, it can lead to irritation. When you take the socks off, there can be lots of dry flakes of skin inside the socks. it can be a real issue for the patient, particularly if it's on a weight-bearing area. Pustular psoriasis, for instance, where you get little pustules associated with systemic psoriasis, they can be quite uncomfortable to walk on. So these conditions all need managing appropriately. Dermatitis, where you get an irritation, particularly an allergy to certain medicaments and creams. It could be an allergy to dyes in shoe leather. These things can present on the foot and can be quite irritating to patients. And then the final non-infection skin condition I want to mention to you today are the skin cancers. You can get cancer on the foot, a melanoma, for instance, can develop on the foot. It's an area of the foot that doesn't get that much protection from the sun. If you're out sunbathing, people tend not to put sun cream on their feet, high factor sun cream to help to prevent the UV damage. So if there's a mole, that could then develop into a melanoma, and these things can be spotted very quickly and easily with something called a dermatoscope for those podiatrists who are trained in dermoscopy, whereby we can pick up early changes in lesions on the feet to make sure they're not becoming cancerous. And if they are, then we can flag them up and get them dealt with quickly before they become a serious problem. So there's a whole list of non-infectious skin conditions there for you to know about. And if obviously you get any of these things and you need any help or advice, or you want to get them resolved, then it's appropriate to see a podiatrist. Please give us a call on 01926 811 272. Visit our website www.healthfirstsouthern.co.uk, or look at our YouTube channel for more information, more videos at Health First Foot and Gait Clinic. Thank you for watching, everyone. Bye.